Hi, my name is Erica Edens, and I'm a registered nurse. I am in the bachelor's program at FSCJ, and I have done my capstone project on bedside shift reporting. What is bedside shift report? Bedside shift report happens when the nurse goes into the patient room to get and receive report at the bedside. The oncoming nurse is able to put eyes on the patient, meet the patient face to face. The patient knows who his nurse is and knows what she looks like. She's able to assess him at the bedside as the off-going nurse is giving report, and the patient has the chance to talk to both nurses and feels directly involved with their care. Spending time at the bedside gives the patient the chance to ask questions and to be directly involved. This gives them a sense of inclusion, which makes the patient a little less nervous about being in the hospital. We have evaluation methods to kind of see how bedside shift reporting works. There's staff surveys. They take into consideration the time that it takes to give report, to see if there were any med errors, and to see if any negative or adverse patient actions happened due to giving report at bedside or giving report at the nurse's station. The benefits for the patients for giving the benefits for the nurses for giving bedside shift report is that it increases our satisfaction. And this happens because it decreases overtime, it increases teamwork and accountability for the nurses, and it decreases medical errors such as wrong med, wrong site, things like that, and it decreases interruptions during shift, so both nurses can really pay attention to their patient, get a plan for the day, and everybody feels comfortable. For the patients, obviously, as we've stated before, it increases their satisfaction. It decreases their anxiety about being in the hospital. They feel like they're part of the care that they're receiving. They actually get to meet the nurse that's going to take care of them for the day, and they just feel a lot more involved. Negative results from bedside shift reporting are relatively low. At first, the nurses feel like, oh, this is going to be more work for me. Why can't I just sit at the nurse's station and give report? Why do I have to go in and bother the patient? But once the nurse becomes consistent and comfortable with this new action, things go a lot better for both the patient and the nurse and everybody on the unit typically. Implementing this would be at the beginning of the shift, the oncoming and offgoing nurse go into the patient's room and introduce themselves. Reports given, vitals, what tests they have coming up, blood work that needs to be done. They review any drips that are hanging. They assess catheter sites and any other tubes or lines that the patient may have. They give the patient the opportunity to ask questions, see what the plan for the day is, things like this. Giving report at the bedside has many more positive outcomes than negatives. It's not implemented in every department in the hospital, but definitely should be. Bedside shift report gives both the patient and the nurse the opportunity to get to know each other a little bit better and to feel comfortable with each other, giving the patient a sense of security and happiness. Thank you.